This is my internship experience at Wilmington Health OBGYN. My internship was with Dr. Vogel at Wilmington Health OBGYN. Wilmington Health OBGYN's mission is to provide quality care to females in and around the Wilmington community. Their goal is to provide the highest standards of medical care to women at every stage of life within a compassionate, supportive, and professional environment. Wilmington Health OBGYN is a part of a larger system of the Wilmington Health Foundation. They provide primary and specialty care. Wilmington Health provides care and advice for women from puberty through adulthood. Most of the patients seen at Wilmington Health OBGYN are insured with private insurance, but they also have patients who are covered by Medicaid and Medicare. Wilmington Health is funded through insurance reimbursements from private carriers as well as Medicare and Medicaid, but also through patient fees. The clinicians who work at Wilmington Health OBGYN consist of doctors, DOs, and nurse practitioners who all specialize in obstetrics and gynecology. They also have certified medical assistants who assist the doctors in patients' rooms with specific procedures. They have ultrasound technicians and people who work in the lab running urine and blood specimens. For my internship responsibilities, when I first started out, I was mostly just shadowing since I don't have any sort of license and can't perform patient care. After observing Dr. Vogel, I began to go into patients' rooms and talk to them about why they were there and figure out if they had any questions or concerns that they wanted to discuss with Dr. Vogel. I would then report back to Dr. Vogel and explain to him what was going on. As I gained confidence and more knowledge on certain topics, I was able to provide patients with some basic information such as the different kinds of birth controls available, why breastfeeding is important, and dietary and exercise restrictions while pregnant. I also got to go to the hospital a few times and be on the labor and delivery floor and watch babies be born. And I also got to see a few C-sections, which was very interesting. When I was in the OR, I observed hysterectomies and removal of ovarian cysts. All of these surgeries that I observed were robotic, which I had never seen before. Since my internship was at a doctor's office, our entire day was spent seeing patients and charting, so the only project that I worked on during my time at Wilmington Health OBGYN was my project for this class, which was on stillbirth education and prevention. I created an infographic, a brochure, and an animated video. I wanted to be able to provide a few different options for people who have different preferences when learning about things. So a shorter version, a longer version, and then someone who just wants to listen to a video or watch a video instead of reading. So for the public health domains, for health promotion, Dr. Vogel is always trying to educate his patients on the importance of vitamin D, vitamin C, regular exercise, and a healthy diet. He also educates his patients on the importance of safe sex practices and regular preventative testing like mammograms, pap smears, and STD testing. He calls these his PSAs, like his public service announcements, that he will preach to all of his patients because he believes that they are very important. For the domain of science and of human health and disease, obviously I spent all day, every day of my internship learning about different diseases and around the women's health, but specifically I learned about different STDs, causes of various menstrual problems, several different surgical procedures and what they can fix, and other women's health problems like ovarian cysts, fibroids, and polyps. I also learned about prenatal care and postpartum care, so specifically the 5 Bs that you're supposed to ask postpartum patients about, which is breastfeeding, birth control, how the baby is doing, if they are experiencing any baby blues or postpartum depression, and if they are having any bladder incontinence, which is very common after giving birth. I also learned about how to find the baby's heartbeat using a Doppler. This definitely took some practice, and a few times, you would get it spot on, but other times you'd have to search for it. And I also learned how to measure the fundal height, which can predict how well the baby is growing and if they're on track. For the domain of professional writing, Dr. Vogel taught me how to chart and what the different abbreviations for charting were and what they meant. He also taught me about the importance of thorough charting because patients won't always see the same doctor every time they come in. So it's important for doctors to be able to see what was discussed at previous appointments and what problems were talked about and what solutions were offered. It's also important for when you see the same doctor for the same problem, you don't want to offer the same solution every single time when it's already been tried. So additionally, for the overview of the health system and health communication, I learned about the importance of HIPAA and ensuring the patient's information is kept safe. We had to do a training on HIPAA before I started my internship. I also learned how to triage patients before Dr. Vogel would come in and report back to him what they told me. This was something that definitely took some time getting comfortable with and figuring out what exactly to say, but it was a great experience, and I learned a lot from it. And finally, for the domain of socioeconomic impacts on human health and human disparities, we had several patients who either had Medicaid or Medicare or didn't have insurance. Some doctors' offices won't accept Medicare and Medicaid patients, so they struggle to find someone who will accept them and get the medical care that they need. We had a few patients who came in that hadn't been to the doctor in 6 or 7 years because they were unable to find a doctor who would accept their Medicaid or Medicare. So for my most important lesson, I think it was the learning that took place within myself and realizing that I am capable of talking with patients and educating them. I was very shy and nervous when I started, and by the end, I had gained so much confidence in myself and my knowledge, and just very sure of myself. And even Dr. Vogel said that he had noticed the confidence that I had gained. So something that I liked the most, I don't know if I can pick just one thing. The entire experience was so amazing and I learned so much, but I really enjoyed getting to go into patients' rooms before Dr. Vogel and talk with them because that is something that will help me later on in my career. Since I want to go to PA school, I'll already have that experience talking to patients when I get there. There wasn't anything that I didn't enjoy about my internship experience, but if I had to pick something, I guess it would be that Dr. Vogel never sits down. So we would stand for 8 to 9 hours a day, and by the end of the day, my feet always really hurt. For my most memorable experience, it was definitely the first time I ever saw someone give birth. I had never seen this before besides movies, and that's not very realistic compared to how it really is. And I will just never forget the first time because it was surprisingly very emotional, but in a good and happy way. And it was a great experience. But I am very grateful for my time at Wilmington Health OBGYN and the opportunity I've had to learn from Dr. Vogel. I will carry this knowledge with me throughout the rest of my career. Thank you.